A video summary of the original blog found here. https://bmidoctors.com/understanding semaglutide's impact on cancer cells. Imagine a medication that not only manages diabetes and obesity but also holds potential in the fight against cancer. Intrigued? Keep watching to uncover the fascinating story of semaglutide. Semaglutide, a GLP-1 receptor agonist, is primarily known for its role in treating type 2 diabetes and obesity. By mimicking the hormone GLP-1, semaglutide increases insulin production, decreases glucagon secretion, and slows gastric emptying. These actions help lower blood sugar levels and reduce appetite, making it effective for weight loss. But recent studies suggest semaglutide might also impact cancer cells, sparking a new wave of research. Some studies indicate that semaglutide could reduce the risk of certain cancers by lowering insulin levels, which are known to influence cancer growth. High insulin levels can promote the growth of some cancer cells, so by lowering insulin, semaglutide might help reduce cancer risk. However, other studies raise concerns that semaglutide might promote the growth of certain types of cancer cells. Understanding these mixed findings is crucial for making informed treatment decisions for patients with both diabetes or obesity and cancer. One key question is whether semaglutide can help prevent cancer. Some studies suggest it might reduce the risk of certain cancers. For instance, a study in the Journal of Clinical Oncology found a lower incidence of colorectal cancer in people using GLP-1 receptor agonists like semaglutide. Another study in Denmark found a lower incidence of pancreatic and liver cancer in people using these medications. Researchers propose several mechanisms by which semaglutide could help prevent cancer, including improved blood sugar control and weight loss. Obesity is a well-known risk factor for many types of cancer, and semaglutide's effectiveness in promoting weight loss might contribute to its potential cancer preventive effects. Some studies suggest that semaglutide may have anti-inflammatory properties, which could also lower the risk of cancer development. There is even evidence to suggest that semaglutide might directly affect cancer cells, inhibiting their growth in lab studies. However, it's important to note the limitations of current research. Many studies are observational and cannot prove causation. More rigorous clinical trials are needed to determine if semaglutide can truly prevent cancer. Safety is always a major concern with any medication. Semaglutide is generally considered safe, but there are specific concerns related to its long-term use. Common side effects include nausea, vomiting, diarrhea, and constipation, which usually improve over time. More serious side effects, such as pancreatitis and kidney problems, are less common but still important to monitor. People with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2 should not take semaglutide. Pregnant or breastfeeding women should consult their doctor before using semaglutide, as its safety in these populations has not been established. Ongoing clinical trials are exploring new ways to use semaglutide to benefit cancer patients. Some trials are testing semaglutide in combination with other cancer treatments, like chemotherapy, to see if it can improve outcomes. Experimental uses of semaglutide include lab studies on cancer cells and animal models to explore its effects in a controlled environment. Future research will focus on identifying which patients might benefit the most from semaglutide and exploring its long-term effects in cancer patients. Researchers are also interested in studying semaglutide's potential in preventing cancer in high-risk populations. As our understanding of cancer biology advances, researchers will continue to test how semaglutide interacts with various treatments. Semaglutide's impact on cancer cells is a complex and evolving field of study, with both potential benefits and risks. Healthcare providers should continue to monitor new research findings and consider them when prescribing semaglutide. Stay informed and keep exploring the possibilities. Semaglutide might just be the key to a healthier future. Keep watching for more insights.